Hi, I'm Michelle Rupp, host of AFMC TV. Thank you for joining us. AFMC TV is a place to consider as a healthcare hub. AFMC is a healthcare nonprofit. We specialize in making our lives, businesses, and communities healthy. This space was created to share information with the community. You'll hear from healthcare experts on a broad range of topics. Medical topics like immunizations and telehealth, to lifestyle topics like strengthening a routine or keeping your family hydrated. Our promise to you is to keep you informed in a digital way, providing useful information to you and your family. Again, thank you for joining us and welcome to AFMC TV. About the vaccine. In the next hour,
very hard to play. This video will provide ideas and also make sure
Hello and welcome to this week's edition of AFMC TV. I'm Michelle Rupp. We're starting off today, continuing our series on catching up on those checkups. We've only got a few weeks left remaining in 2021, so we want to be sure and get those checkups taken care of. Today, we are talking about women's health and the importance of women-specific checkups. Joining me today is Dr. Beth Milligan. She's one of our doctors here at AFMC. Dr. Milligan, thank you for joining us.
Good morning, Michelle.
So I want to start by asking just how important are women's health checkups?
They're really important. And, I'm a woman. I have my own doctor. So I might actually speak for more personal reasons of why I go to the physician. I want to talk about my risk factors. And first of all, we know that prevention is the most important thing you do. You want to see things before it becomes a whole nightmare, like hypertension, high cholesterol, heart attacks. So it's real important to go to your doctor early so that they can look at your risk factors and address those risk factors.
What are some of the conversations we should be having with our doctors?
Well, first of all, you want to make an appointment and actually go in. Don't put it off. And it's really good not to wait till the very end of the year because doctors get really busy. And so you need to call now because we're in September and get an appointment. At that point, when you go in, I suggest you have a list of questions to go over because the doctor could be very busy and you want to kind of help guide them where your concerns are. So be prepared to talk about your family history, all the things that's happened to your parents, your brothers and sisters, all of their medical problems. Those are important things to know. Number two, remember, if there's any meds you on, you can take them with you if you need to, because, remind people, have them in your bag because other doctors may have prescribed them, have those in there. And also, if you've had surgeries way back from other doctors, have that list of information. Also know if you have a pharmacy, that pharmacy contact information, know your allergies to all of the medicines that you've taken in the past. All the information you can have to take to your provider at that point would be absolutely very helpful.
Yeah, I would think the more information you as the patient can provide, the more well-rounded of a treatment plan or an assessment the doctor is able to provide.
Absolutely, because at that point when they see you, depending on your age, they start measuring your risk factors and deciding what kind of things they need to focus on. Some things you may not have a high risk factor for heart disease, so that kind of is more basic prevention, but you might be really high risk for breast cancer. So your doctor can fine tune your prevention based on your risk factors.
Customize and personalize, right?
Yeah, absolutely. It's not one size fits all. Not really. It shouldn't be.
No, it shouldn't be. So what ages and what screenings should women be getting prepared for?
Absolutely. Well, we base that on a lot of what they call United States Task Force has those measurements. You'll see some changes depending on if it's the American Academy of Pediatrics or the American Academy of Family Medicine, sometimes they'll differ and they'll give different recommendations. So that's why it's important to sit down with your own doctor and tailor that prevention to you. Some of the biggies would be perhaps things like the women's gynecological exams will start somewhere between the year of 18 years old up to 21. It's unique to that patient, but that's when you need to first sit down with your provider and decide what you need. Second of all, you're talking about mammography. Assuming you have not a lot of high risk factors for breast cancer, they'll start mammography actually at the age of 40 or 50. They'll fine tune it. Now, when you're talking about gastrology, things like colon cancers, they'll actually start those colon screenings actually more at the age of 50. They'll do it younger if you have a family history of colon cancer. So it's not a hard answer to that. So that's why a good preventative exam will help you know when you need to do those particular prevention screenings.
And having those conversations with your family members, because if you don't know there's something in your family history, you wouldn't know to then be able to share that with your doctor that might trigger a screening that might happen sooner than age 40 or 50 or what have you.
You may find out you had two cousins have colon cancer, and you want to tell your provider about that. And the doctor may say, hey, let's start your colon cancer screening younger than we normally would have because you have a new cancer pop up in your family.
Yeah. Okay. I'm curious too, if just by seeing a primary care physician, is that good enough?
Well, that's a loaded question, Michelle, because some providers actually do a lot of the services and they're trained to do, colonoscopies, and they're trained to do the women's health exams. Other doctors will sit down with you and say, hey, I need to send you to a gynecologist, or I need to send you to a gastroenterologist to do these testing. So that's why it's important to sit down with your provider and see what they can offer you at that point. So yes, you need to see a dentist, because I don't know any doctors doing dentistry and some of those extraneous specialties.
Sure. My last question, how do you relieve some of the anxiety or the fear of some of these doctor's appointments that you might have as you get up in age? Because our bodies are changing as we age. And there may be a sense of fear that, well, if we don't pull back that curtain, we won't know what's there. And sometimes it's easier to just keep your head buried in the sand than to, face something or think that, gosh, I don't want to know. I'm sure there's nothing here. I just don't want to know. What do you say to alleviate some of that?
Well, Michelle, then I'm going to have to go personal in that because I'm a breast cancer survivor. So yes, I had those fears. But the way I alleviate my fears is to arm myself with information, because information usually in the right information for me can alleviate a lot of my fears. And so I think it's important to search that. And when you start, asking your friends and relatives and your neighbors to give you advice on it, they may not give you good advice and can actually create more fear. So I literally go to the proper sources and I calm myself that way before I go in, so I don't have the fear when I go for each of my preventative screenings to see if my cancers come back.
Okay. That's good advice. That's real good advice. Well, while we have you for a moment, I'd like to switch gears, if you'll let me, and talk about flu season, because we are on the cusp of flu season. And last year, we didn't have or at least it didn't seem that we had as a robust flu season like what we've seen in years past. So how do we need to prepare for this year?
Well, I researched that, and according to the Center for Disease Control, they only had 20,000 reported cases of influenza last year. And they think it's probably because we were wearing masks and socially distancing and washing our hands and being extra careful. As a result, we didn't see a lot of influenza because we were protecting ourselves from the COVID virus. So as a result, they didn't see much of it. Now, for me, and what I recommend the influenza vaccines are going to be given now. So talk to your provider if they've got them ready. I recommend people in the younger age groups to go ahead and get them before the end of October. Make that your goal. Now, the older groups, people in the 60s and above, probably need to get it right now. And if you're trying to get your coronavirus vaccine too, kind of spread that out by a few weeks, because you might have side effects to one or the other, and you'll know which vaccine caused the side effects. But I definitely recommend getting an influenza vaccine in addition to the COVID vaccine.
Could we be looking at a super flu, so to speak, this year, or maybe just a robust flu season this year?
Yes. Okay, so this is what the predicted outcomes are from the CDC. We didn't have much flu activity in the U.S., so they really didn't have the ability to create the vaccines based on the previous virus, okay? So they didn't have that. So they had to go to South America, where they still saw a lot of influenza activity, and they made the vaccine based on that particular virus that was floating around. So that's what we'll be getting this year. They feel like initially on that it's going to do a really good job of protecting us from getting influenza. However, they're saying towards about December to January, we may see mutations occur of the influenza virus occurring. And because we're so well protected and we're wearing our masks, we haven't had that natural exposure to it to create our own antibodies in addition to having the vaccine. So we may see a really super virus coming out. Well, you might say a mutation is the more correct word of that when it's escaping the vaccine January, February. Who knows? It's what they're saying.
Let's hope that's not the case. I don't know if we can take much more of these aggressive germs.
Michelle, I always go for I always look positive about things. So I personally feel like things will get better.
Yes, I'm with you on that one completely. Best advice on protecting against the flu? I mean, obviously the shot. What about the nasal spray, hand washing, all the regular things we know to do now?
Yeah, those are all the good standbys, but I think, something important is the mental health side of it, because if you're getting plenty of rest and you're trying to eat healthy, getting your nutrients that you good through just good nutrition and just good mental health will help protect your body, probably better than all of the things that the doctors preach that you just mentioned. I think that is so important. And I think you can even talk about exercise. Exercise is probably way up there on boosting your immune system. If you don't run, that's okay. Walk, go outside. We won't far less likely to get the virus walking outside. Walk outside. There are plenty of parks are open right now. Beautiful, beautiful. Arkansas, Little Rock is so beautiful. Walk outside, take some deep breaths, and just relax and be happy you're still healthy and alive.
Yeah, that's an excellent point. My mom used to always say, the more run down you are, the more susceptible you are to catching a cold. And so it was, an apple a day and making sure we got our vegetables and just keeping our health up so that we didn't get run down.
Yes, that's true. That's all the things our grandmother told us is still true. Take care of yourself mentally, physically.
And your body will then take care of you.
Absolutely.
Okay. Dr. Beth Milligan, thank you so much for joining us today. It's always a pleasure having you on.
Thank you.
Joining me now is Dr. Jean Way. She is the director of the Institute of Aging at UAMS. Dr. Way, thank you so much for joining us today.
Thank you, Michelle. I'm delighted to be here.
It is a true pleasure. I'm excited about this topic because we're talking about aging. And my first question, I'm curious, what is a geriatrician?
Michelle, that is a great question. So many people don't realize there is such a person as a geriatrician until, when they really need someone. Of course, it's better always to be early and to prepare. And all of us, if we're lucky, are going to be aging, right? So considering the alternative, it's a pretty good deal. Okay, a geriatrician, there are different definitions for, different people and different populations, but the fact of it is, geriatrics has now evolved into a subspecialty of either internal medicine or family medicine that will, once you complete an internal medicine residency or a family medicine residency, you can then go on to a fellowship in geriatric medicine, and then you can be certified as a subspecialist. So that's the, if you will, the accepted standard definition of a geriatrician. However, every single one of us has personal and professional experience with aging and with older persons, not only in our personal life, in our community, but also professionally. So as long as somebody has the experience, the interest, and the expertise through experience taking care of older persons, I think they can qualify as a geriatrician, even if they don't seek board certification. I've had many clinicians who've approached me about how to get certified, and the problem is you have to have a 12-month fellowship, and many clinicians who are actively practicing just cannot get away for 12 months. So even though they're not geriatric subspecialty certified, I would certainly consider them as geriatricians.
So as we age, when is a good time for us to consider seeking the help, the advice, the counsel from a geriatrician?
That is even a better question, which is, when should we start? And here's the answer. The secret is this. If you have an older friend or parent or family member, encourage them maybe to go seek advice, and you make sure you go with them, because whatever advice they get, you're going to now be on the in, and you're going to know how to continue to do well, stay healthy, and stay well. Because, for most people now, 60 is the new 40. I'm sure you've heard it. And we want to keep that going. And pretty soon we want 80 to be the new 50. It's not impossible. We just have to prepare. We have to, live healthfully. Those are the things that I think if we can try to adhere to at least a few of them, we will do better. We will keep healthy. And all of us, when we get to be 80, we'll probably be 45.
I like that math. I like how you do that.
New math. Yeah.
That is good. That is good. Well, Dr. Way, we could talk to you all day long, and I hope that you will come back. You've got so much information that we'd love to be able to get out. Thank you for joining us today. And thank you so much for joining us today. We'll see you back here next Wednesday for more AFMC TV.